Transplant survivors, we do know from a lot of research that they are at lifelong risk for late complications and late effects. At the same time, there are several health system, institutional, patient and provider level barriers that prevent them from getting the care that they need. So what we did in this study was we used the innovative idea of taking data that has been submitted by transplant centers already to our national clinical registry, the Center for International Blood and Marrow Transplant Research, the CIBMTR. And with that, we used our consensus international guidelines that tell us what to do with respect to long-term follow-up for transplant survivors. So we combined both those resources to come up with what we call an individualized treatment summary and survivorship care plan that focused on patient-specific exposures. So what had they been exposed to during the transplant process that would guide the long-term follow-up care they needed. So we took transplant survivors and we randomized them to either this care plan or to routine care that they would be needing anyway, or they would be getting anyway. And over a 6-month period, what we noticed or what we found was just providing this information significantly decreased the distress that these patients had about their survivorship care. So again, this is the first time that we've used this innovative model of using a central data resource to provide a survivorship care plan, which obviously makes that a lot more efficient and hopefully cost effective as well. And as next steps, we are working to see how we can implement this more broadly and also try to see how we can investigate this further with self-management techniques that can further facilitate the care of these transplant survivors.